Good afternoon, Calvin Dennis. My name is Mihiraa. Let's start the warm-up session. Why did you choose OT?
It is my long-term ambition to work as a registered nurse in any English-speaking country such as the UK, Ireland, and so on. To meet the requirements to register as a nursing professional there, I need to prove my English language proficiency. Hence I choose OET to fulfill my dream. Moreover, OET is tailored according to the needs of nursing professionals, therefore I believe I could perform well in this test.
Describe your typical working day.
My day starts with a prayer. After completing my daily routines, I reach my workstation by 7:30. Before taking the handover, I complete my inventories and update the crash cart medication and dressing trolley. After receiving the handover, I interact with my patients to identify their health needs. Based on my assessment plan, a nursing care plan, and provide quality care for my patients. Afterward, I assist the physician in his work and carry out necessary clinical orders. Meanwhile, I find some time to interact with my colleagues and maintain a good rapport with them. My duty ends by 3:30 after giving a handover to the next scheduled staff members.
What do you find is the hardest part about being a nurse?
I think the hardest thing I've had to deal with is feeling helpless. While it's my job to provide as much care and comfort as medically possible, there are times when I just can't do more. Seeing someone in pain or feeling miserable and knowing there's nothing you can do to help is the most difficult thing I deal with. I am a nurse because I genuinely care about people and want to help, and when I can't, that's hard.
What are the current trends in nursing?
Some of the current trends in nursing include telehealth and technology in healthcare, the use of telecommunication and information technology to provide healthcare services. In the field of education, graduate education, and advanced practice is on the rise. There is a push toward encouraging nurses to pursue higher education and advanced credentials, such as master's degrees and advanced practice registered nurse roles. There is also a shift from hospital-based care to community-based care, as more patients prefer to receive care at home or in outpatient settings. Alongside, nurses are coming up with innovation and entrepreneurship, that is, nurses are opening their own healthcare businesses, developing new products or services, or working for non-traditional employers.
How do you handle the stress of the job?
To handle the stress of the job, I prioritize self-care and seek support from colleagues and loved ones. I maintain a healthy work-life balance by scheduling regular breaks, engaging in activities I enjoy outside of work, and practicing stress relief techniques such as mindfulness or exercise. Additionally, I make sure to communicate openly with my colleagues about any challenges I'm facing and seek their advice and support when needed. Taking time to decompress and recharge allows me to approach my work with renewed energy and focus, ultimately ensuring that I can continue to provide the best possible care to my patients.
Your preparation time is over. You can now start your role play.
Good morning, Mihiraa. It's nice to see you today. I see you're here for your regular follow-up. How have you been feeling lately?
I've been okay, Nurse Calvin, but I'm really not keen on getting this wound dressed today. I just don't want to go through it again.
I hear you, Mihiraa. I can understand how this process might feel overwhelming at times. Let's take a moment to talk about your wound and the underlying condition, just to make sure we're on the same page. Can you tell me what you understand about your peripheral vascular disease, or PVD?
Well, I know it's something to do with my blood circulation, but that's about it. Honestly, it's all a bit confusing.
That's perfectly okay, Mihiraa. It's completely understandable that not everyone is familiar with medical terms and conditions, so let me break it down for you to ensure we're on the same page. Peripheral vascular disease, or PVD, is a condition where the blood vessels, especially the arteries in your legs, become narrowed or blocked. This narrowing restricts the flow of blood to certain areas of your body, particularly your legs and feet. Now, blood is essential because it carries oxygen and vital nutrients to every part of your body. When these vessels are narrowed, the affected areas don't receive the oxygen and nutrients they need. This reduced blood flow is why the wound on your leg isn't healing as it should. The lack of proper circulation means your body is struggling to repair the damaged tissue. And Mihiraa, I would like to know your understanding of the complications it has on you.
Yes, that's why it's taking longer than usual to heal. And I have nothing to do with this.
I understand how frustrating this must be for you, Mihiraa. To better understand your concerns, could you please share with me your reasons for refusing the wound dressing? This will help us work together to find a solution that works for you.
Yes, that makes sense. Nurse, I just can't handle the pain when they dress the wound. It feels like it hurts more than it helps.
I'm really sorry to hear that the dressing changes have been painful for you, Mihiraa. I completely understand how difficult and distressing it can be to go through that kind of discomfort, especially when you're already dealing with so much. Please know that your pain is something we take very seriously. There are definitely steps we can take to manage your pain better. For instance, we can apply a numbing cream to the area before we start the dressing. This will help to dull the sensation and make the process much more bearable for you. If you feel that you need a bit more relief, we can also arrange for you to take a mild painkiller beforehand. This will help you feel more at ease. Mihiraa, it's important to remember that the dressing plays a critical role in your healing process. Even though it can be uncomfortable, the dressing acts as a protective barrier over your wound. It helps to keep out infections and maintains a moist environment that is ideal for healing. We want to make sure we're doing everything possible to promote your recovery and prevent any further complications.
I guess that could help, but what happens if I don't get dressed today?
Mihiraa, I completely understand that the whole process of wound care can feel tiring and frustrating, especially when it seems like things are moving slowly. But it's important to know that this care, although it may feel slow, is the best way to ensure your wound heals properly. Regular wound care is crucial because it creates the optimal environment for your body to repair itself. By keeping the wound clean and protected, we're helping it to heal as efficiently as possible. Without proper care, there's a real risk that the wound could get worse instead of better. For instance, an untreated wound can easily become infected. Infections can cause a lot of pain, swelling, and redness, and if they spread, they can be very difficult to control. In severe cases, if an infection isn't treated in time, it could become untreatable, leading to very serious consequences, including the possibility of needing an amputation to prevent the infection from spreading further. I don't want to alarm you, but I do want to be honest about the risks. The best way to avoid these complications is to stay on top of your wound care. Please remember that each step we take in caring for your wound is a step towards your recovery and better health. Do you have any concerns or questions about this, Mihiraa?
Yes, I didn't realize it could get that serious. I'm just so tired of it all.
I completely understand that, Mihiraa. Now, can I have your consent to begin wound dressing?
Yes, I suppose I should go ahead with the dressing then.
That's a wise decision, Mihiraa.